Bismillah ar-Rahman ar-Rahim. This is the third lecture of breast cancer. I will talk now about staging of breast cancer. Breast cancer is classified with the TNM classification system, which groups patients into 4-stage groupings based on the primary tumor size. The letter T is the first letter of word tumor. The regional lymph nodes status, the letter N, this is the first letter of word node. And if there is any distant metastasis, the first letter M, the first letter of word metastasis. The most widely used system is that of the American Joint Committee on Cancer. I will talk now about the primary tumor. TIS, this meaning carcinoma in situ, Paget's with no tumor. T1, this meaning the tumor less than 2 cm in size. T2, this meaning the tumor size between 2 to 5 centimeters. T3, this meaning the tumor larger than 5 centimeters. T4 divided into T4A, this meaning chest wall involvement. T4B, this meaning skin involvement. T4C, this meaning both T4A and T4B. T4A and T4B. T4D, this meaning inflammatory carcinoma. I will talk now about regional lymph nodes. Regional lymph nodes. N1, this meaning mobile ipsilateral auxiliary nodes. N2, this meaning fixed matted ipsilateral lymph nodes. N3, this divided into N3A ipsilateral infraclavicular nodes. N3B, this meaning ipsilateral internal memory nodes. N3C, this meaning ipsilateral supraclavicular nodes. I will talk now about distant metastasis. The word metastasis, this is the first letter of this word. M1, this meaning distant metastasis. I will follow up now about staging of breast cancer. Stage 0, this meaning a tumor in situ, N0, M0. Stage 1 divided into stage 1A and stage 1B. For example, stage 1A, T1, N0, M0. Stage 1B, this meaning, for example, T1, N1, M0. I will talk now about stage 2, this divided into stage 2A and stage 2B. For example, stage 2A, this meaning, for example, T0, N1, M0. T2, N0, M0. I will talk now about stage 2P. For example, T2, N1, M0. T3, N0, M0. I will talk now about stage 3. This is divided into stage 3A, stage 3B, stage 3C. For example, stage 3A, N2, T0, M0. T1 into M0, T3 into M0. Stage 3P, for example, T4 N0 M0, T4 into M0. Stage 3C NT N3 M0. And stage 4, this meaning M1 advanced breast cancer, and there is metastasis to other part of the body. Stage 4 NET NEN M1. This meaning there is metastasis to other part of the body. I will talk now evaluation. Evaluation of the patients with the breast cancer needs a triple assessment using clinical evaluation or physical examination, imaging, and tissue biopsy. Mammography is the most commonly used modality for diagnosis of breast cancer, as we see here. Ultrasonography is useful in assessing the consistency and size of breast lumps. Ultrasonography has a great role in guided needle biopsy, as we see here. I will talk now about MRI scan. MRI scan has good sensitivity for describing abnormalities in soft tissue, including the breast. MRI scan is indicated if there are occult lesions or suspicion of multifocal or bilateral malignancy, especially invasive lobular carcinoma. And in the assessment of response to neoadjuvant chemotherapy or when planning for breast conservation surgery and screening in the high-risk patient. We are seeing here case of MRI scan for breast cancer. We are seeing here abnormal area. And we are seeing here case of invasive breast carcinoma. And we are seeing here case of invasive lobular carcinoma. There are different ways to take a tissue specimen, and these include fine needle aspiration cytology, FNAC, core biopsy or trocut, and incisional or excisional biopsy. I will talk now about the treatment or management of breast cancer. The two basic principles of treatment are to reduce the chance of local recurrence and the risk of metastatic spread. Surgery with or without radiotherapy achieves local control of cancer. We are seeing here surgery for breast cancer, as we see, and we are seeing here surgery and radiotherapy. When there is a risk for metastatic relapse, systemic therapy is indicated in the form of hormonal therapy, chemotherapy, targeted therapy, radiotherapy, or any combination of these. In locally advanced disease, Systemic therapy is used as a palliative therapy with a small or no role for surgery. I will talk now about surgical oncology. Surgery has a major role in the treatment of breast cancer. Surgical oncology is the basic way to use for local control of the disease. I will follow up surgical oncology. Radical mastectomy of Halsted, as we seen in this slide, which removed the breast with auxiliary lymph node dissection and excision of both pectoral muscles, this meaning major and minor pectoral muscles, is no longer recommended due to the high rate of morbidity without a survival benefit. Now, the modified radical mastectomy of Betty is more famous, as we seen here. It entails removing the whole breast tissue, as we seen here, with a large part of the skin and auxiliary lymph nodes. The pectoral muscles, minor and major pectoral muscles, are preserved in this operation. Breast only removal without auxiliary dissection is referred to as simple mastectomy. This procedure can be performed in small tumors with negative sentinel lymph nodes. The operation is called breast conserving surgery. BCS is aimed at removing the tumor plus a rim of at least 1 centimeter of normal breast tissue. This is called wide local excision. And the operation called a quadrantectomy, this meaning involves removing the entire segment of the breast contains the tumor. This is the quadrantectomy. And this is the operation called breast conserving surgery, or PCS. The last two procedures, breast conserving surgery and quadrantectomy, are usually combined with auxiliary clearance through a separate incision. Lumpectomy is the removal of benign mass without excision of the normal breast tissue, as we seen here. Now I will talk about auxiliary procedures. This may include sentinel lymph node biopsy, sampling partial 2, or complete auxiliary lymph node dissection. In the end of this lecture, thank you for all.